Hi everyone. We might just wait until a couple of minutes after the hour to start. We've got quite a few people coming in now. Okay, that's 3 past the hour. Are you happy enough to start, Mark? You're on mute there. Is that all right?
Yeah, thanks very much, Patty.
No worries. Okay, guys. Yeah, well, welcome everyone to this seminar today. My name's Paddy Gibson. I'm a postdoctoral research fellow at the Jumbunna Institute here at UTS. And Mark just asked me to facilitate this seminar today. We're really lucky Mark has organised a seminar for us, Dr. Mark Thomas. He's an academic here at UTS in the Centre for Health Economics Research and Evaluation in the Faculty of Health. Mark and myself are both members of UTS staff for Palestine. It's been a real privilege to get to know Mark and to learn from his expertise over the last 9 months or so. And Mark has lived experience in Palestine. He lived there for many years in the West Bank, working as both a human rights activist, working in the NGO sector, and also has a very deep knowledge of the health system in Palestine, which is what we're going to be hearing about today. So I will pass over to Mark. The way we're going to run this seminar today is that Mark is going to give us a presentation. I would like to acknowledge that we're all, if we're tuning in from Australia, on stolen Aboriginal land. Mark has a fuller acknowledgement. I know he's going to give as part of his presentation. Yeah, but people tuning in from stolen land right across the country, I think, along with a good cohort from here at UTS. So Mark will give us a presentation, and then we will move to some questions and discussion. If you have questions as Mark is talking, feel free to put them in the chat, and I'll collate those and can put them to Mark during the Q&A. So yeah, we'll run it that we'll hear from Mark, and then we'll have some of the collated questions, and then if we have time, we can open up to also hearing questions people indicating to ask. We've got an hour and a half scheduled. Mark has indicated he's definitely got some time to hang around longer than that if people want to continue to the discussion. But I will pass to Mark now to begin his talk on Gaza, a health system in crisis. Thank you, Mark.
Thanks very much, Patty. Are you able to hear me okay? I think so. So I'd like to start by acknowledging that I'd like to acknowledge the Gadigal people as the original inhabitants and custodians upon the stolen land that the University of Technology Sydney was built upon. The Indigenous struggle on this continent is an ongoing struggle against the legacies of settler colonialism, apartheid, and genocide. The resistance of Indigenous Australians reflects and amplifies the resistance of First Nations peoples everywhere. Liberation requires long breath. I acknowledge the health workers of Palestine, without whose steadfastness and resilience we would truly be lost. And I would like to welcome all of our Palestinian and Lebanese sisters and brothers who are joining us here today, and in particular, two very special people who are personal heroes of mine, Dr. Bushra Othman and Dr. Jamal Marai, whose courage empowers us all to bear witness to the people of Gaza. So my name is Mark Thomas. I'm a senior research fellow at the Center for Health Economics Research and Evaluation here at UTS. My research focuses on health policy analysis and program evaluation, improving health equity, and health systems development in national conflict settings. I consider myself a critical applied economist, which just means that I'm interested in the way that power dynamics influence public policies and outcomes, and that I want my work to be of practical use to stakeholders. For the past 22 years, I've been an impassioned teacher, student, researcher, and activist, an advocate on behalf of the Palestinian struggle. I first visited Palestine in 2002 in the midst of the Second Palestinian Intifada, or uprising. Within an hour of my arrival to the city of Nablus, which you can see on your screen here now, my life was completely transformed. Over the next 12 years, I lived in Palestine and worked in Palestinian civil society organizations, specializing in international education and advocacy, community development, women's empowerment, and the rights of people with disabilities. Now, I've been doing this for a pretty long time, and I know very well the desire to want to tell the entire story, to validate the experience of every person who's been touched by the tragic history of Palestine. I can't do that today because I don't have enough time and because that's actually not my story to tell. So today, I'm a health economist, and our discussion is on a health system in crisis and how it came to be that way. I'm going to be hitting you with a lot of statistics today. Sorry about that. My sources are UN agencies, world-leading humanitarian and human rights organizations, and peer-reviewed academic literature. All of those citations will be made available to anyone who would like them. I assure you, they make for pretty dire reading. Finally, I'm sorry that I'm not able to be there with you in person on campus at UTS today. To my regret, the senior university administrators at UTS withdrew their support for this seminar. They told me that it was too sensitive and that it could risk the well-being of students to dedicate an entire hour to the topic of Gaza's health system. Needless to say, I strongly disagree. As researchers, educators, health professionals, and people of conscience, we're obligated not to look away, no matter how disruptive the act of learning may be for those with a vested interest in the status quo. So I extend to each and every one of you my heartfelt gratitude for being here today. So I thought we could start by just placing ourselves in space and in time and have a quick look at the political geography of the space. So over here to the east, we have the Jordan River, which descends from the Sea of Galilee, where my son Liam was born, down here to the Dead Sea, and then further south to the Gulf of Aqaba. In the west, we have the Mediterranean Sea. Yeah, so you may have heard in the news or at protests, from the river to the sea, that's what they're referring to, the geography between the Jordan River and the Mediterranean Sea. Now, the colorful tableau to the right of your screen is known as the West Bank. That's the West Bank of the Jordan River. It's home to about 3.26 million Palestinians. And those people are concentrated in the built-up areas that are shaded here in brown. The dark brown areas correspond to Palestinian urban areas, so like cities. So in the north, you have cities like Jenin, Nablus, Tel Karam, Qalqilia. More in the middle, you've got cities like Ramallah, Jerusalem or Al-Quds, and Jericho. And then further south, Bethlehem and Hebron. You also have in this space, shaded in blue, 695,000 illegal Israeli colonists. So you'll notice two things, hopefully, about this area shaded in blue and dark blue. First of all, that's known as Area C, and it comprises about 60%, or the majority of the space in the West Bank. Second, those blue areas, which are under full Israeli civil and military control, encircle the Palestinian population centers, which separates them from one another into isolated cantons and breaks the territorial contiguity of the West Bank. Now, down here along the southwestern coast, we have the Gaza Strip, which is a narrow strip of land. It's about 365 kilometers square. It runs 41 kilometers along the coast and shares a 13-kilometer border with Egypt at Sinai. Gaza City itself, in the north of the Gaza Strip, is actually a very ancient city. It's been inhabited since at least the 15th century BCE. And historically, it was a cosmopolitan port city that linked Alexandria in Egypt with Alexandretta in modern-day Turkey. As of a year ago, there were around 2.23 million Palestinians living in Gaza. So that's around 6,100 people per square kilometer, which makes it one of the most densely populated places in the world. 41% of the population in Gaza is under the age of 15. In this middle geography here, we have the internationally recognized state of Israel, in which there live 6.6 million Jewish Israelis, comprising around 71% of the population of that geography, 2.1 million Palestinian citizens of Israel, comprising around 23% of the population of the state, and another 570,000 or so other non-Jewish, non-Arab citizens. That's not the whole story. We also need to recognize that to the east here in Jordan, and then north in Syria, and northwest in Lebanon, there are another 3.4 million UN-registered Palestinian refugees. The West Bank and the Gaza Strip are under military occupation by Israel. So together they comprise the occupied Palestinian territory. That territory forms the geographic basis for the nascent state of Palestine, which has been recognized by around 3/4 of the member states of the United Nations. Now, unfortunately, political discourse about Palestine often focuses solely on the occupied Palestinian territory at the expense of the millions of Palestinians living as citizens in Israel and in the diaspora. Israel's military occupation of the West Bank and Gaza entails a complex matrix of annexation, expropriation, closed military zones, military bases, settler colonies, a separation wall, which in places is 3 times higher than the Berlin Wall, a network of mobile and permanent military checkpoints, pervasive surveillance, military incursions, arbitrary detention, imprisonment, torture, increasingly AI-driven extrajudicial killings, permit regimes, pass laws, and myriad other forms of bureaucratic control. Israel's system of settler colonial rule in the occupied Palestinian territory has been declared by leading human rights organizations Amnesty International, Human Rights Watch, and B'Tselem, and adjudicated by the International Court of Justice to be an illegal apartheid regime. Now, following the UN General Assembly's endorsement in November of 1947 of a proposal to partition the land of Palestine between Jews and the indigenous Palestinian population, Jewish forces there began forcibly displacing Palestinian residents from their homes. This continued with the expiry of the British Mandate and the unilateral declaration of Israeli statehood in May of 1948. In the subsequent outbreak of war, more than 750,000 Palestinians were systematically, ethnically cleansed from their homeland. It's an event that has come to be known by Palestinians as the Nakba, or the catastrophe. The vast majority of those refugees fled to the West Bank, Gaza, Jordan, Syria, and Lebanon, where they and their descendants remain overwhelmingly still in camps in a state of permanent temporariness. The Gaza Strip is a political name given to the areas around Gaza that were not under Israeli control at the time of the 1949 armistice agreement with Egypt. And like the West Bank, it was demarcated on maps during those talks by the so-called Green Line. So if you hear of the Green Line, that's what they're talking about. This is the armistice line. Around 70% of Gaza's population, that's around 1.55 million people, are UN-registered refugees that were forcibly displaced from their homes in what became the State of Israel. In 1967, Israel launched a preemptive war against Egypt, Syria, and Jordan, which it won decisively. Israel militarily occupied the remainder of Palestine, illegally annexing East Jerusalem and colonizing the territories that it had conquered by force, including in the West Bank, Gaza, the Syrian Golan Heights, and the Egyptian Sinai. Now, Israeli settlements in the Sinai were evacuated as part of the Camp David Accords that were signed between Egypt and Israel in 1978. In 2005, Israel unilaterally evacuated its 8,000 colonists from Gaza, but critically retained full control over the entire territory, including access by land, sea, and air, control over the water and electricity grid, and the electromagnetic spectrum for communications. There's broad international consensus, and it has been adjudicated by the ICJ that Gaza remained under belligerent occupation after 2005, and that as the occupying power, Israel remains legally obligated to ensure the welfare of the people in that territory. Now, under pressure by the Quartet, the Palestinian Authority held fresh legislative elections in 2006, of which Hamas won a plurality of the vote and an outright majority of seats. This entitled it to form a government. Israel, the United States, Europe, and Fatah, the majority party in the outgoing Palestinian Authority government, immediately imposed sanctions and subsequently a targeted resumption of aid in order to undermine and force the collapse of the newly established Hamas-led government. This was supported by widespread repression, abduction, and targeting of Hamas officials by Israeli and ousted PA forces. This led to a major schism and a proto-civil war between Fatah and Hamas in 2006, 2007, which I witnessed and was quite horrifying. It culminated in the ouster of the Hamas government and reinstallation of Fatah in the PA in the West Bank, and the consolidation of a Hamas-led civil administration in Gaza, neither of which holds a democratic mandate. Both of these entities, Fatah and the PA in the West Bank and and Hamas in Gaza, are under military occupation. Neither comprises a sovereign ruler in its respective territory. Israel has restricted the movement of people and goods into and out of Gaza since at least 1991. But after declaring Gaza a hostile entity in 2006, it radically intensified its blockade of the territory. Now, under this intensified siege, Israel imposed draconian restrictions on aid, commerce, and movement. The Israeli Ministry of Defense has admitted it actually calculated the minimum caloric requirement needed to keep the civilian population of Gaza alive. Over 1,000 basic commodities variously banned by Israel included things like livestock, jam, chocolate, coriander, candles, shampoo, nappies, A4 paper, cleaning sponges, wedding dresses, cement, and water and sewage pumps, among many others. The territory's agricultural sector was also targeted alongside the rest of the economy, which left 58% of Gaza's population completely dependent on international aid for its survival by the beginning of 2023. As explained by senior Israeli official Dov Weissglass in 2006, the idea was to put Palestinians on a diet, but not to make them die of hunger. Now, according to Oxfam, the separation policy has had devastating implications for civilians in Gaza, limiting the import of essential goods, including materials necessary for reconstruction, shutting down Palestinian internal trade and export to international markets, and preventing Palestinians in Gaza from leaving to visit family, access healthcare, seek employment, or access education, clearly comprises a policy of collective punishment. Now, Israel's military occupation of Gaza and its siege has led to staggering rates of unemployment and poverty. In 2023, unemployment in Gaza was at 45% overall, 60% youth unemployment. Now, that's unemployment, which is a function of labor force participation and doesn't reflect people who have dropped out of the labor market out of frustration of being unable to find work. Barriers to economic opportunity have driven a cycle of dependency and reliance on negative coping strategies to meet basic needs, including the depletion of savings and accumulation of high levels of household debt. That financial precariousness has reduced households' resilience to shocks. As a result, people in Gaza have become strongly dependent on humanitarian aid and other external sources of income, including remittances. The fundamental economic distortions of the occupation, along with Israel's control over the collection and disbursement of Palestinian tax revenues, perpetuates the dependency of the Palestinian economy on donor support. Gaza is highly urbanized and densely populated. Solid and infectious waste management is severely curtailed by the occupation, and high volumes of agricultural runoff and partially and untreated sewage are regularly released into the environment, causing widespread degradation of soil, the coastal aquifer, and marine ecosystems. Now, prior to the latest conflagration, the current conflagration, only 6% of the Gaza population had access to safely managed piped drinking water, 6%. In 2023, Gaza had on average 10 hours of electricity per day. That's less than a third of what was generated, less than a third of which was generated locally. Again, Israel controls the vast majority of the supply of water and electricity. That lack of electricity has exacerbated water treatment capacity issues. In 2015, the United Nations Conference on Trade and Development stated that Gaza was likely to become unlivable by 2020 due to Israeli de-development of the territory. This was reaffirmed by the UN Special Rapporteur Michael Link in 2018, which is 5 years before the outbreak of this latest round of hostilities. The Palestinian health system is very complex, with multiple parallel sectors, including mutually exclusive ministries of health in the West Bank and Gaza, the United Nations Relief and Works Agency, or UNRWA, NGOs, and private providers, which are all supported by a patchwork of independent, charitable, and state-based donors. In Gaza, the main primary healthcare provider is UNRWA. Gaza's health system is almost completely financially dependent on international donors, and it's acutely vulnerable to the withdrawal of external funds. The Palestinian health system has long struggled to provide adequate essential services due to the consequences of the occupation, persistent fiscal constraints, as well as mismanagement and cyclical violence. Gaza has been repeatedly devastated by a series of major escalations of hostilities with Israel in 2008, 2012, 2014, 2021, and 2022. These operations have been called by Israeli authorities as mowing the lawn. They cause fatalities, injuries, extreme mental health needs, and destruction of civilian property and public basic infrastructure, hindering development and aggravating deficits. Gaza's limited health system capacity has left most of the population at risk, especially patients that have chronic disease or who need specialized treatment services that they're unable to access in Gaza. Gaza faces persistent shortages of essential medicines. The monthly availability of essential medicines, which is defined as more than a month's supply of remaining stock at the Ministry of Health in the Gaza Strip, has averaged 55% in the 3 years from 2019 to 2021. The health system has also long suffered from major shortages in specialized personnel, facilities, and health technologies. Now, faced with a high and growing burden of non-communicable diseases, which include oncology, diabetic, and cardiac cases, Gaza's health system has relied very heavily on external referrals, primarily to Israel, the West Bank, and Egypt. However, Israel has imposed severe restrictions on patients exiting Gaza to obtain essential medical care, including arbitrary denial and repeated delays by Israel for permits for patients and their companions, and complicated and lengthy procedures for obtaining those referrals in the first place. In 2016, Israeli human rights organization B'Tselem reported that Israel had routinely denied or simply ignored 25% of all requests to transfer patients in Gaza to Israel or to the West Bank for treatment. With respect to cancer, surgery is the main intervention in Gaza, usually due to the absence of any other option. More than 85% of surgical treatment of cancer is done without adjuvant or neoadjuvant chemotherapy, owing to the shortage of those drugs. Similarly, radioisotopes and radioactive substances used for diagnosis and radiopathy have long been restricted from entering the Gaza Strip. In 2022, life expectancy in Israel was 85.1 years for women, 81.8 years for men. In Gaza, it was 75 years for women, 72.5 for men. That's a 10-minute drive and a 10-year gap in life expectancy. Infant mortality is 4 times higher in the occupied Palestinian territory than in Israel. As of 2022, 990,000 people in Gaza were severely food insecure, leaving them more vulnerable to developmental issues and disease, especially children. The occupied Palestinian territory also has one of the highest burdens of mental health issues and psychological disorders in the Eastern Mediterranean region, with 54% of Palestinian boys and 47% of Palestinian girls between the ages of 6 and 12, presenting emotional and/or behavioral disorders. Continual hostilities have heightened risks and exacerbated the vulnerabilities of young people in Gaza, resulting in high rates of anxiety, depression, and pervasive traumatic stress disorder, all of which are known to increase high-risk behavior. Now, longstanding challenges in the funding and integration of mental health care services have left the MOH struggling to deal with the ever-growing demand there. So this is just a really brief snapshot of the situation in Gaza prior to the current catastrophe. And I think it's critical context for understanding the pre-existing precarity of the Palestinian population and its acute vulnerability to what will come next. On October 7th, 2023, Palestinian fighters broke through the perimeter barrier around Gaza, and they attacked Israeli military installations and civilian communities, resulting in the deaths of 695 Israeli civilians, including 36 children, as well as 373 active service combatants and 71 foreigners. Around 250 hostages were taken, and dozens remain held in captivity in precarious conditions in Gaza. You're looking at a picture of a home in the Israeli kibbutz of Nir Oz, which was attacked on October 7th. This is a community that I spent a lot of time in, which I know very well. Friends and members of my own family lived here. The attacks of October 7th were undoubtedly traumatic for countless people in Israel and abroad. And it is immediately clear that the events of that day have precipitated a paradigm shift in Israeli society. For the past 53 weeks, Israel has been committing genocide against the Palestinian people, with the wholehearted political support and resources of its Western allies, including Australia. This unfolding genocide has been recognized as such by experts in international humanitarian law, including the UN Special Rapporteur on the situation of human rights in the Palestinian territories occupied in 1967, Francesca Albanese, leading human rights and humanitarian organizations, and countless internationally renowned scholars, including many Jewish and Israeli scholars, such as Associate Professor of Holocaust and Genocide Studies at Stockton University, Raz Siegel, Professor of Holocaust and Genocide Studies at Brown University, Omer Bartov, Professor of Human Rights Law at Queen Mary University in London, Neve Gordon, Professor of Economics at Columbia University, Jeffrey Sachs, Professors of Holocaust History and the Department of Jewish History and Contemporary Jewry at the Hebrew University of Jerusalem, Amos Goldberg, and my own former father-in-law, Professor Daniel Blattman. Israel's actions have been adjudicated as a plausible genocide by the International Court of Justice, and the chief prosecutor of the International Criminal Court has requested arrest warrants for Israeli Prime Minister Benjamin Netanyahu and Defense Minister Yoav Gallant for war crimes and crimes against humanity, including starvation and extermination of the civilian population in Gaza. Israel's actions subsequent to the events of October 7th have been broadly illegal. The country has thoroughly disregarded international humanitarian law and publicly repudiated its enshrined obligations to distinction, proportionality, and the protection of civilians. Israel and its international allies, principally the United States, have ignored provisional measures set out by the ICJ to prevent genocide, ethnic cleansing, and other crimes against humanity in Gaza. Critically, on the basis of wholly unsubstantiated allegations, these countries, including Australia, cynically colluded to force the collapse of the United Nations Relief and Works Agency, UNRWA, the leading humanitarian agency in Palestine and the only organization capable of delivering life-saving aid at scale in Gaza. Deep emotional and ideological retrenchment on the question of Palestine has been exacerbated by the widespread preponderance of misinformation, disinformation, and atrocity propaganda in the media and at the highest levels of government in Israel, the United States, Europe, and Australia, much of which has been thoroughly debunked. The resulting onslaught has been nothing short of apocalyptic. The current period of violent conflict from October 2023 to the present is the most deadly and destructive episode in the history of the Israeli-Palestinian conflict by orders of magnitude. Nearly all of Gaza's 2.23 million people have been forcibly displaced from their homes. Israel has exterminated tens of thousands of Palestinian children. It has systematically razed Gaza to the ground. Just look at these pictures. Homes, businesses, mosques, churches, government buildings, hospitals, clinics, police stations, schools, universities, water and sewage infrastructure, roads, aid distribution facilities, childcare centers, markets, parks, farms. No person, no structure, no property has been spared. Multiple mass graves have been uncovered. Water and electricity have been shut off. Humanitarian aid blocked. All formal education has been forcibly shut down. Gaza's health system has been utterly decimated. Famine and preventable communicable disease are now widespread. Having long been held captive under Israel's protracted and illegal siege of the territory, the people of Gaza have been left acutely vulnerable to this latest catastrophe. As of October 10th, 2024, the Palestinian Ministry of Health in Gaza has reported that more than 52,000 people have been killed and more than 97,000 have been injured as a direct result of Israeli military violence. That's gunfire, shelling, airstrikes, etc. This number includes a conservatively estimated 10,000 plus people presumed buried under the rubble. Now, among the injured, the WHO estimates that around 25% are likely to have acute and ongoing rehabilitation needs, including about 15,000 extremity injuries, 3,000 to 4,000 amputations, more than 2,000 major head and spinal cord injuries, and over 2,000 major burns. Now, notwithstanding that these direct casualty figures are almost certainly an undercount, given the Ministry of Health's compromised capacity to record such data due to the destruction of most of its infrastructure, the full impact of the genocide is undoubtedly far higher when taking into consideration the deaths from starvation and disease. As observed in The Lancet, in recent armed conflicts, these so-called indirect deaths ranged from 3 to 13 times the number of direct deaths. By extension, the death toll in Gaza as of October 2024 will plausibly fall within the range of 156,000 to 676,000, or 7% to 30% of Gaza's pre-war population. As to the appropriate multiple, estimates should reflect Gaza's pre-war fragility, as well as the intensity of the conflict, the destroyed healthcare infrastructure, severe shortages of food, water, and shelter, the population's inability to flee to safe places, and the loss of funding to UNRWA. $1.9 million people, that's 90% of the population, are now internally displaced, the majority of which multiple times. As of the 9th of September of this year, more than 55 evacuation orders remained in effect, covering up to 86% of the Gaza Strip. By April of 2024, 6 months ago, Israel had dropped an estimated 70,000 tons of explosives on the Gaza Strip. That exceeds the cumulative bombing of Dresden, Hamburg, and London during World War II combined. By July 2024, Israel had damaged or destroyed 63% of all built structures in the Gaza Strip, including an estimated 360,000 homes, affecting more than 1 million people. As early as November of last year, only a month into the genocide, 60% of education facilities, 60% of ICT facilities, and 70% of commerce-related infrastructure in Gaza had been damaged or destroyed. By March, 57% of water infrastructure and assets had been damaged or destroyed. As a result of damage to infrastructure and the lack of power, the water sanitation and hygiene system, the WASH system, has collapsed, with local water production capacity estimated at less than 5% of usual output. The Gaza population is receiving, on average, only 3 to 7 liters of water per capita per day. That's below the minimum WHO short-term emergency requirements of 7.5 to 15 liters per capita per day in humanitarian emergencies, and far less than the 50 to 100 liters needed to ensure basic needs are met and health concerns are mitigated. By August, more than 3,000 kilometers of roads in the Gaza Strip had been obliterated. That's 68% of the total road network. Also by August, 68% of the agricultural land in the Gaza Strip had been damaged or destroyed. By June, the war had generated some 39 million tons of debris, under which are buried the remains of tens of thousands of human beings. This lethal rubble, hundreds of thousands of tons of which are contaminated with asbestos and other hazardous substances, as well as thousands of tons of unexploded ordnance, will take an estimated 15 years to clear. The soil and coastal aquifer are likely to be widely contaminated by now by chemicals and heavy metals that are used in munitions. Sewage, wastewater, and solid waste management systems and facilities have collapsed, leaving displaced people seeking shelter among mountains of rubbish and awash in raw sewage. The rainy season is coming. As of the end of January 2024, direct damage of around $18.5 billion. This is January. $18.5 billion had been inflicted on the built infrastructure of Gaza. That's around 100% of the gross GDP of the occupied Palestinian territory. Reconstruction and rehabilitation costs are expected to be several multiples higher. In September, the UN Independent International Commission of Inquiry on the Occupied Palestinian Territory found that Israel's security forces had failed to adhere to the principles of precaution, distinction, and proportionality, constituting the war crimes of willful killing and attacks against protected objects, namely Gaza's health facilities. Israeli security forces, the commission concluded, have deliberately killed, wounded, arrested, detained, mistreated, and tortured medical personnel and targeted medical vehicles, constituting the war crimes of willful killing and mistreatment and the crime against humanity of extermination. As of January 2024, Israel had damaged or destroyed 84% of all health facilities, including hospitals, clinics, and pharmacies, severely impacting Gaza's health system capacity. As of the 20th of August of this year, only 16 of Gaza's 36 hospitals and 58 of its 132 primary healthcare facilities remained even partially functional. Of these, the majority are only partially accessible or inaccessible because to patients due to insecurity, damage to the facilities and surrounding roads, and broad evacuation orders. Israel has also damaged or destroyed 130 ambulances, leaving only 6 ambulances for the entire territory operational as of January. As of August, out of 14,192 cases requested for medical evacuation, only 5,012 had been evacuated, 35%. Responding to Israel's limited resumptions of medical evacuations in late June 2024, the Palestinian British surgeon, Dr. Ghassan Abu Sitteh, commented that this is barely cosmetic. Forget about the pileup of cases that need to be taken out. What about the daily toll of wounded children? Where are they being treated? As of August, Israel had killed 775 health workers and injured 1,082 across the occupied Palestinian territory. Israel had also abducted 128 health workers, many of whom have been tortured and some even executed while in the custody of Israeli forces. Gaza's health information systems have been severely disrupted by the destruction of its IT infrastructure, the disruption of telecommunications, and prolonged blackouts, impeding effective reporting, prioritization, and response. Depletions in essential medical supplies due to direct damage, fuel shortages, and electricity disruptions have led to severe stockout of vaccines and other essential medicines across Gaza, particularly in the northern areas. Shockingly, doctors in Gaza have been forced to conduct surgical procedures, including cesarean sections and amputations, without anesthetics. Israel has systematically destroyed Gaza's entire educational sector. Since October of 2023, Israel has denied the right to education to all children in Gaza. That's approximately 625,000 students. For a 15-year-old student living in Gaza, the current genocide would be the 5th and most devastating major conflagration she's lived through. that has caused the entire education system to halt. At least 84% of schools will require full reconstruction or significant rehabilitation before schooling can resume. Israel has completely destroyed all of Gaza's 11 universities, including the territory's only tertiary medical educational institutions, the Islamic University of Gaza and Al-Azhar University, interrupting the studies of nearly 90,000 university students. Israel has severely restricted and in many cases comprehensively prevented civilian access to humanitarian aid in Gaza. Complex administrative procedures, delays, and denial of entry have left long queues of aid idling at the border. The Israeli military has also systematically attacked deconflicted humanitarian aid workers and assets, such as in the targeted killing of 7 World Central Kitchen staff in April, and murdered civilians collecting aid, such as in the Flower Massacre, in which Israeli tanks opened fire on a large crowd, killing 118 civilians and injuring more than 750. Extremist Israelis have also routinely attacked humanitarian convoys en route to Gaza, injuring aid workers and destroying supplies. The UN and its humanitarian partners are working to deliver humanitarian support at an unprecedented cost in terms of human lives lost. As of September 2024, Israel had killed 220 UNRWA staff in Gaza, including 6 members in an Israeli airstrike targeting a school sheltering displaced civilians. The capacity to deliver aid depends on effective deconfliction and coordination of humanitarian movements, as well as greater access to supplies and equipment. The longer impunity prevails, the more international humanitarian law and the Genevan Conventions will become irrelevant. After taking control of the Rafah crossing with Egypt, all emergency medical missions into Gaza were paused by Israel. When these were resumed via Jordan, EMT personnel were limited to 2 carry-on size bags, and they were severely curtailed in their ability to bring in emergency medical supplies. Israel maintains an opaque and labyrinthine system restricting the import of medical supplies and equipment and humanitarian aid. Recent restrictions also include forbidding anyone of Palestinian descent, including people with Palestinian parents or grandparents, from traveling to Gaza as part of international emergency medical teams. Effective real-time communication and coordination are paramount. In a recent mission undertaken by the Palestinian Australian New Zealand Medical Association, PANSMA, they saw a team in Gaza take some 5 hours to travel less than 2 kilometers. The group's coordinator in Australia was forced to apply online to Israeli authorities for sequential permits to move through closed military zones, sometimes as little as 100 meters at a time. Israel's complete closure of the Gaza Strip to the import of basic goods and services, including emergency humanitarian aid, medicine and medical supplies, electricity, food, and fuel, has led to widespread famine and a precipitous fall in the nutritional status of Palestinians in Gaza, who now make up around 80% of all people facing famine or severe hunger worldwide. This rapid rate of decline in a population's nutritional status is unprecedented globally. By January of 2024, nearly 16% of children in Gaza, that's 1 in 6, were acutely malnourished. Almost 3% were suffering from severe wasting, putting them at high risk of medical complications and death. Over 90% of children aged 6 to 23 months and pregnant and breastfeeding women face severe food poverty. As of September of 2024, there were 34 cases of individuals who had starved to death, the majority of whom were children. As of September 2024, nearly a year into this campaign, the entire population of Gaza was experiencing, at minimum, IPC Phase 4 emergency acute food insecurity. And nearly 500,000 people faced IPC Phase 5, catastrophic acute food insecurity, among whom starvation, death, destitution, and extremely critical acute malnutrition is evident. Oxfam has stated that Israel is unequivocally using starvation as a weapon of war against civilians in Gaza. This view is broadly shared throughout the humanitarian community, including by the UN Special Rapporteur on the Right to Food, Michael Fakhri, who stated that Israel made its intentions to starve everyone in Gaza explicit. It implemented its plans and predictably created a famine throughout Gaza. What we're witnessing in Gaza is the starvation of 2.3 million people. We've never seen a civilian population made to go hungry so quickly and so completely. More than 500,000 women of reproductive age lack access to essential services, including antenatal care, postnatal care, family planning, and management of sexually transmitted infections. There are over 50,000 pregnant women in Gaza, with 5,500 due to give birth within the next month. That's 180 deliveries per day, 1,400 via cesarean section. Miscarriages in Gaza have increased 300% under Israeli bombing. Women face life-threatening infections and complications in pregnancy and birth. And perinatal EMTs report women being discharged hours after labor into insecure, overcrowded, unsanitary living conditions without sufficient medical support, water, nutrition, or basic supplies for their newborns, including nappies and formula. According to UNICEF, women are giving birth outside of hospitals, among ruins, in cars and tents, in overcrowded shelters, with barely 1.5 meters of space. There's a complete lack of privacy and a lack of proper medical care, including pre- and postnatal care. The collapse of the WASH system has left Gaza's population extremely vulnerable to infectious diseases. This vulnerability is particularly acute as we approach the rainy season, as flooding and damaged infrastructure is expected to radically exacerbate unsanitary conditions. Ongoing constraints by the Israeli authorities on the entry of essential supplies are particularly harmful for children, pregnant women, and people with compromised immune systems, and are increasing stress and anxiety in overcrowded shelters. Currently, shampoo, detergent, soap, and dishwashing liquid are largely absent from the market. As a result, community kitchens cannot thoroughly clean pots, shelters are left unclean, and families struggle to wash their clothes, vegetables, cooking utensils, and even to shower. Healthcare facilities are also struggling to obtain essential cleaning materials to protect patients, staff, and caregivers. Health authorities in Gaza report a dramatic surge in infectious diseases, including hepatitis A, jaundice, lice, scabies, impetigo, diarrhea, acute respiratory infections, coliform bacteria, and most shockingly, polio, which was confirmed in a 10-month-old unvaccinated child from Deir el-Balah, the first case in Gaza in 25 years. As of January, at least 90% of children under 5 were affected by one or more infectious disease, and 70% had had diarrhea in the past 2 weeks. This has direct implications on their nutritional status and of those children and of other vulnerable populations. Around 350,000 residents with chronic disease have extremely limited access to their medications and essential medical procedures, such as dialysis. This includes some 45,000 patients with cardiovascular disease, more than 1,500 patients in need of kidney dialysis to maintain life, more than 650,000 people with raised blood pressure, and 60,000 with raised blood glucose. More than 2,000 patients are diagnosed with cancer each year in Gaza, of whom around 6 to 8% are children. The rate of healthcare attacks and infrastructure destruction has meant that most active cancer treatment, including pain relief for palliative care, has almost stopped within the first 4 weeks of the conflict, as well as an almost total cessation of new diagnoses. Airborne asbestos and fine particulate matter resulting from the bombing and demolition of buildings throughout the Gaza Strip has increased the risk of cancer, asbestosis, and other chronic respiratory diseases. Owing to pervasive trauma linked to the ongoing violence, mental health has deteriorated significantly, especially among vulnerable populations, including women, children, the elderly, and persons with disabilities. Medication shortages, continuing hostilities, recurrent displacement, and a lack of proper shelters are negatively affecting the mental health of these populations, particularly those who have pre-existing mental health disorders. Repeated forced displacement has resulted in the separation of families, which has eroded social protection systems, especially for women and children in Gaza. Severe overcrowding in shelters, coupled with abysmal water and sanitation conditions, and the scarcity of soap and hygiene products, are also depriving women and girls of their privacy and dignity, while making them more vulnerable to infections and diseases. Multiple evacuation orders in recent months have forced gender-based violence response service delivery points to close or to relocate, and has displaced beneficiaries, which has interrupted service provision, including medical care for survivors. The shortage of tents and facilities that may be converted into safe operational spaces is also hampering partners' efforts to scale up gender-based violence prevention and response services, including case management and specialized mental health and psychosocial support. Now, despite all of the destruction of the past year, as they have always done, Palestinians continue to rebuild and to plan for the reconstruction of their health system. This picture is actually taken from inside Shifa Hospital after it was destroyed. You can see the burn marks in the walls. As they do so, global experience and best practice has shown that a number of core principles should be considered as recovery plans are being developed, including balancing urgent needs against medium and long-term needs, ensuring an approach to building back better and more resiliently, which in this case requires an upending of the political status quo vis-a-vis Israel and the occupation, targeting the most vulnerable, and ensuring inclusive and participatory planning through a whole of society approach. The ultimate aim is a self-sustaining, sovereign healthcare system with the capacity to provide world-class, culturally appropriate healthcare to all Palestinians. Such a system would be effective, in which Palestinians have the local capacity to deliver high-quality healthcare in their own country, equitable, in which all patients have access to high-quality, affordable care that is culturally safe and socially acceptable, and efficient, in which expenditure is sustainable and comprises value to Palestinians. Now, messaging to donors needs to be unified and consistent. Palestinians are entitled to health sovereignty and national self-determination. It is the obligation of the international community to support local priority setting led by Palestinians. When the agenda is set externally, even good-intentioned donors may be undermining the sustainability of the health system. The Gaza Health Initiative is an international coalition of health professionals, humanitarian agencies, and academics advocating for the reconstruction and rehabilitation of Gaza's health sector. The GHI, which has undertaken a comprehensive needs assessment to inform priority setting and resource mobilization, has organized a series of international conferences, first in Amman and then in Beirut and Amsterdam, to plan for the reconstruction and rehabilitation of Gaza's health sector. I was very fortunate and extend my thanks to Cher for enabling me to attend that conference in Beirut. Now, the GHI's reconstruction and rehabilitation framework draws on the WHO's building blocks for health systems development, which encompasses leadership and development, service delivery, health system financing, health workforce, medical products, vaccines and technologies, and health information systems. Operationalization of these building blocks is conceptualized over 4 phases. First, in the response, we have a rapid rollout of 92 priority emergency healthcare interventions, which are based on the Disease Control Priority Project's highest priority package for universal health coverage. That's a mouthful. That covers emergency care, maternal and newborn health, child health, health system services, mental health, surgery, infections, non-communicable disease, WASH, palliative care and nutrition, provision of acute psychosocial care, telehealth to support workforce capacity, deployment of WHO emergency medical kits to ensure access to medicines and essential health services, mobilization of international donors, and more. With respect to governance issues, those have been intentionally set aside and deferred at the moment due to the political dynamics and uncertainty about who those political partners will even be. Alternative service delivery models are identified as being crucial, including the provision of mobile clinics, field hospitals, and telehealth services. In the transition phase, we have a restoration of essential services, including the refurbishment and upgrading of medical facilities and assets, enhancing workforce capacity, including through international EMT deployments, scale up of prioritized health interventions, enhanced data collection, and a consolidation of coordination functions. In the rebuild phase, large-scale bottom-up reconstruction of the entire health system takes place, which will enhance the system's resilience and sustainability. The GHI's strategic roadmap includes a comprehensive needs assessment, strategic planning, mobilization of resources, and intersectoral reconstruction operations, underpinned by sustainable funding and evidence-based decision-making. Rebuilding must also prioritize rehabilitation of Gaza's primary health sector. The goal is a sovereign, sustainable health system in accordance with 6 overarching principles: evidence-based resource allocation, financial stability, robust capacity building, quality and access, horizontal integration, and national ownership. Now, a multi-sectoral approach to rebuilding Gaza's health system recognizes that health outcomes are actually about a lot more than just the provision of health care. They encompass social, environmental, economic, and political aspects. In Gaza, established models for care for primary health services have been severely undermined by the comprehensive and repeated displacement of the local population, the systematic disintegration of embedded community-based social arrangements, and widespread family separation, rendering a large number of children acutely vulnerable to malnutrition, disease, exploitation, and abuse. By March of 2024, UNICEF had estimated that at least 17,000 children had been separated from their families. The International Rescue Committee estimates that number is more likely to be as high as 51,000. The environmental damage caused by Israel is extensive and will require massive and sustained remediation. As the occupying power, Israel is also obliged under international law to ensure economic opportunity for the people under its effective control. This is paramount to rehabilitation of the region and binational rapprochement in the long run. You need only look to other contexts like the peace and reconciliation process in Northern Ireland, for example, for pertinent examples of the importance of economic opportunity to reconstruction and peace building. Finally, the reconstruction and rehabilitation of Gaza's health sector cannot be abstracted from political reality. This territory is under an illegal military occupation. Israel's apartheid regime has systematically denied Palestinians their fundamental rights to health, security, and self-determination. We need to acknowledge that political reality in order to transform it and repair the intergenerational damage that has been done over the past 74 years. Now, there are a number of requisites to bring the rehabilitation of the health system to fruition. With respect to financial independence, a health system that's financially dependent on development partners often has limited control over priority setting and expenditure, which is strongly influenced by donors and by international priority setting institutions like the WHO. Now, when that agenda gets set externally, as I mentioned, even good-intentioned donors may be undermining the sustainability of the health system because sustainability implies that public expenditures reflect locally determined priorities and values. That's what we mean by efficiency and by sustainability. And health systems that rely on development partners are acutely vulnerable to the withdrawal of funds by those donors. Schemes are often short-term, they prioritize direct services and specific diseases, and they place limits on expenditure for things like administration, overhead, and capital expenses. And that can make it very difficult to develop sustainable interventions that can be integrated on a permanent basis within the public system. Similarly, recipients may not be able to allocate funds to quote-unquote non-health areas, including governance, economic development, or other priority areas, even though those kind of investments potentially represent the optimal allocative efficiency. External development partners are often not subject to local governance, including robust reporting requirements, which puts them outside of public control and makes it very difficult to critically assess the impact that those programs are having. Nor are development partners typically required to coordinate their efforts with one another, which can lead to potential service gaps and duplication of efforts and other kinds of waste. And finally, donor funds, especially state-based funds, often come with very severe caveats, including mandatory compliance with foreign sanctions regimes, which are restrictions on who a recipient is allowed to work with, irrespective of how important those stakeholders might be to the program's feasibility and acceptability. And this is particularly salient in national conflict settings where donors use aid to advance their own vested interests, in particular political outcomes. A robust public governance enables full coordination at all levels, including collaborative needs assessments, priority setting and evaluation of options, and joint decision-making that utilizes existing structures like the Ministry of Health, the WHO's Health Cluster Mechanism, and the GHI. We need comprehensive open access mapping with clear details of who's doing what, as well as systematic reporting and information sharing. Now, that data enables accountability for service providers and donors, but also accountability also to hold Israel to account for the costs inflicted by the occupation. And stakeholders need to be keeping track of their activities with respect to who, what, when, where, how, and how much. That data should be, to the extent possible, it should be compatible with existing systems like the DHIS2 in the Ministry of Health in Gaza and the West Bank. Now, integration with those kinds of systems can be really challenging to integrate, both technically and culturally, but investments today are going to be absolutely critical to long-term success. Finally, development partners should prioritize supporting local capacity building. Gaza has highly qualified, experienced personnel, including community-based doctors, nurses, and allied health professionals and administrators. The genocide has severely impacted those local capacities, including the death, injury, and exodus of health personnel and the disruption of higher education. And those disruptions need to be remedied as a matter of priority. And through its programs to ensure the continuing education and support of health personnel, partners to the Gaza Health Initiative, including Bears 8 University and other Palestinian institutions, are doing exactly that. Now, at the Gaza Health Initiative's recent conferences in Beirut and Amsterdam, Palestinian Legislative Council member and General Secretary of the Palestinian National Initiative, Dr. Mustafa Barghouti, stressed that without a comprehensive ceasefire, no amount of planning, resource mobilization, or academic research will enable the reconstruction and rehabilitation of Gaza's health system. Ending the genocide and the illegal occupation of Palestine is a basic and fundamental condition for recovery, and it must be the absolute priority of international advocacy on behalf of the Palestinian people. Thanks very much.
Thanks so much, Mark. Might just take a second to absorb that actually. Yeah, really devastating and thorough account of the genocide that we're seeing unfolding before our eyes. People can comment or put a question if you'd like in the chat on the side. Just before we move to the questions and the discussion, I would just like to take this opportunity just off the back of it. It's just terrific, Mark. It's just so moving hearing your analysis and testimony today. I do think it is important just for colleagues and others who are on this Zoom to know that there is quite strong organisation happening at UTS and across campuses in solidarity with Palestine and against the genocide we see taking place. And just to give two very quick updates, our staff union, the National Tertiary Education Union, on the initiative of a number of staff on this call, including Mark, have taken a position now supporting the academic boycott of Israel. So as a union, we are advocating for there to be no relationships with Israeli institutions, and specifically our own university, UTS, has a formal relationship with the Israel Institute of Technology, and we're calling for that to end. And it's actually up for review. The MOU runs out in March next year, so at the very least, the university needs to commit that it's not going to renew that MOU and contribute in any way to the horror that Mark has detailed for us today. the National Union of the NTU is also now backing that position. There was a National Council meeting 2 weeks ago where the union nationally voted for an academic boycott. It was a real breakthrough in terms of the politics of tertiary education and support for the Palestine Solidarity Movement. And just finally, I'll say people at UTS or any other supporters can come and join staff and students, our staff union, the NTU, our group UTS Staff for Palestine, and student groups, including the Student Association, are supporting a demonstration at 1:30 on the Alumni Green on the 23rd of October. So I'll put the flyer for that in the chat if it'll take images, but we're going to be rallying there to pursue this demand of our university cutting ties with Israel, with the weapons companies that are inflicting the horrors that Mark's put on the screen, and also with the tertiary education institutions in Israel that we know are contributing. So that's just a few words from me as the chair to encourage people to get involved in the solidarity movement here on campus. We've got some questions that have come into the chat now. As I start to pull those together, I might just start with a question mark. Obviously, many of us are really trying to grapple with the horrific images that we've seen over the last 48 hours of people being burned alive who are receiving care from the hospital system in Gaza. Could you maybe talk a little bit about attacks on the hospital system? I mean, it was mentioned in your talk, but if you could maybe talk some more about what you see is happening in terms of whether there's a strategic, how you see attacks that are happening actually on healthcare workers, on the healthcare system by Israel, and how you see this in their broader strategy.
That's a really fantastic question. What I've given today is a summary of, the aftermath of those attacks. What's missing here is the context in which those attacks took place and how those actually start small and scale up, and how that process is allowed to transpire. So in the very early days in mid-October, you may recall Israeli forces started to experiment with the targetability of Palestinian health infrastructure by testing out what would happen to them, to Israel in the international community and in international discourses if it were to attack those facilities. So what you would see is, for example, a bombing in the courtyard of Al Ahli Hospital, or targeting of personnel on the periphery. And then they would wait. They'd float it in the international media and see what was the response. And time again, the political response and the White House, the US White House response was consistent and obnoxious, well, it's unclear what happened in the fog of war, and we'll trust that Israel has as a robust democracy, will investigate appropriately, and we've expressed concern, and we'll wait. And then we heard nothing. There was no action ever taken. And that first outburst of outrage that came on behalf of that came after the first attacks was quite muted, and it dissipated, and then Israel did it again. And necessarily, the second time it happened, it was less shocking. So as it moved forward, we became inured to the idea that hospitals were being targeted. Hospitals and medical personnel were being targeted. Now, that's not happening in a vacuum. That outrage is fading, but that's because it wasn't being articulated by the institutions that should have been unrelenting in their opposition. So the medical colleges, and let's just look at, we'll take responsibility for our own situation here at home in Australia. Where were the medical colleges? Where was their outrage when the first hospital was targeted? When medical personnel started being disappeared? Where was their official outrage? What about the medical programs in universities in Australia? when Islamic University of Gaza and Al-Azhar University were demolished, where was every single Australian university with a medical or nursing or allied health program? Where was their outrage? Now, because those core institutions failed to voice their outrage, the politicians failed to voice outrage. And when the politicians failed to voice outrage, it was clear to the Israelis that they could do it again. And they ramped it up strategically, slowly over time until it became something that nobody felt that they could reply to at all. So there's the voice on the street, but it was the organizational voice, the institutional voices that were missing. So I think there's a really important lesson there in terms of when we voice our outrage, and when we make our stand, who do we do that vis-a-vis? Do we do that vis-a-vis empty streets downtown on Sunday afternoons? Or do we do that vis-a-vis our own colleagues in our own institutions, which I assure you is much harder? Which isn't to say that the protests don't have a role. They do. They have an important role, especially in community building and sustaining the movement. But in terms of political advocacy, I think they've fallen quite short in that regard.
Thank you, Mark. There have been a number of questions in the chat along similar lines um, about your ideas for strategy for the movement going forward, and what we can do to stop the genocide. Would you like to speak any further to that question about strategy and where next? Because yeah, there's been a number of reactions in the chat. People obviously very moved by your presentation and just asking for your thoughts on where
Yeah.
to.
Thanks for that. Look, I think I want to make a couple of quick comments in terms of strategy. I'm no expert in strategy. If I knew the strategy, certainly wouldn't. I'd certainly have already been doing that. So I don't think there's a magic bullet, so to speak. I don't think there's one strategy that is superior to others, and we learn as we go for sure. Importantly, there is so much amazing work being done. You and I, Patty, only know each other because we bothered to reach out through a mutual friend to say, who else is interested? Who else is working on this? And we built a whole community around it, not realizing that literally that person sitting across from me at the cafe shared my concerns and was ready to go to action on these issues. The Gaza Health Initiative is a remarkable example of that kind of international collaboration that came together and is being held up by the passion of its members. And I might just mention Dr. Omar Latouf in particular, and his ability to continue to drive that forward with an amazing team of supporters. Now, in terms of the different kinds of strategies, I would also say, and I think this is actually really important, and it's been an issue that we've discussed recently in our own group, that not only is there not one superior strategy, but every bit of that advocacy and all those different kinds of strategies, they work together and they all have their own role to play. And you may not find yourself personally finding a role for yourself in each and every strategy, which isn't to say that those shouldn't be pursued. I don't personally feel that I have a lot to contribute in the public protest. It's not good for my PTSD, and I've done that part. I think my role is elsewhere at this stage of my life, which isn't to say that the protests aren't critical. So I think as people of concern and as activists, we need to recognize that everybody will bring something different to the table. You may not find yourself comfortable in that particular action, and it's your job to find where you are comfortable and where you do have a contribution to make, but to maintain the forward momentum in a sense of unity with the bigger picture in mind. So to not criticize each other's language, or to not degrade each other's efforts with respect to what you think is best, but rather to recognize that it all matters. Everything that you've got the ability to do matters. And just finally, I would say that with respect to sustainable activism, in my experience, you just need to start where you are immediately. I don't know the prime minister, so writing him letters is probably not the best use of my time, and it's probably not going to have the best impact that I can have. I do know you, Patty, and I do know my colleagues at work. So starting with those conversations probably will be more impactful, starting with friends and family and colleagues. That's probably a more strategically sustainable way of pursuing activism, social change, in my experience.
Thanks very much, Mark. And just on that, I just would, I guess, invite colleagues to consider the context that we're in. I mean, like Mark has said, we have a group, UTS Staff for Palestine. We have been advocating for the university to break its ties with both the weapons companies that are profiting off this genocide. Unfortunately, UTS does have strong research relationships with a number of major companies that are producing weapons that are unleashing the horrors that were on the slides that Mark presented, including Thales, including Lockheed Martin. Um, so we're calling for that, but there is this immediate issue as well of the university considering the future of its partnership with the Israel Institute of Technology. And we do know that that institute is part and parcel of the war machine. It contributes a lot of research to the production of weapons that are unleashing those horrors. It has a very high number of staff who've actually come across directly from the IDF and are collaborating very closely with the occupation. So this is important. This is something we feel we can push on now and make a difference around now as the university is considering its relationship. We've had correspondence from the Vice Chancellor saying the university has its partnerships and we review them all the time, and indicating that there is consideration now of this partnership. So we feel this is something we can push on to make a bit of a difference. But I would also just like to highlight for people the personal cost that Mark has gone through in terms of being able to continue to talk publicly to his research. As he said at the start of the session, this seminar is now online rather than in person due to the fact that support for it was withdrawn, from Mark's faculty. So we really have a job supporting each other to be able to continue to speak the truth and to be able to continue to speak to the horrors that Israel is unleashing. Just telling the truth, the basic peer-reviewed research that Mark has presented here today is considered to not be acceptable as public academic work, as activity within our institution. And I think we really have to change that situation. And that involves supporting each other to be able to continue to stand up and speak out. So I'd just like to acknowledge that, Mark, that it took a lot for you to actually continue with this effort, and we've all benefited greatly from it, and we're all a lot stronger and more knowledgeable for our advocacy efforts going forward. So thank you for your courage through this process. There's some people in the room.
Sorry, Patty, I just want to interrupt for
Course.
very briefly. I want to say thank you for that. And I also want to acknowledge my UTS and my share colleagues who are here today, including my center director, Professor Viney, and my supervisor, Professor Richard Diabro Lorenzo. So I just want to acknowledge that I do feel supported by them today, and I deeply appreciate their presence here today. I think it would also be a missed opportunity if we couldn't please open the floor to Dr. Omar Latouf, if you would be willing to share with us a few of your thoughts, Dr. Omar. We'd be very grateful to hear from you.
Dr. Mark Thomas, thank you very much for an amazing presentation. And thank you all for being here, listening and learning from Mark. On behalf of the Gaza Health Initiative and the many hundreds of supporters around the globe and the dozens of organizations that have partnered and continue to partner with the Gaza Health Initiative, I salute you for what you have said, what you have done. The encyclopedic presentation that you have given deserves to be published and preserved for the future. I wish to take this occasion to invite each and every one of you to join us as we try to organize and create a global association of humanitarian, pro-health, health advocacy, and pro-academic organizations from around the globe so that we can all speak in one voice in support of equality, justice, and freedom for the people of Palestine. We hope that we can create an organization that can mobilize, gather, facilitate interaction between charitable organizations, humanitarian organizations to come to aid Gaza now and to aid in the future other areas where tragedy may hit, be those tragedies man-made or natural tragedies. I recognize and understand that there are many international organizations that do that. But with the level of catastrophic events that are forthcoming in Gaza, the West Bank, Lebanon, and probably expanding, sadly, I'll say that we are only on the verge of the major catastrophe that's happening. And we need to build capacity to train more people, treat more people, and support more people, and deliver more aid. And thus, it's important for us not to be in despair, but on the contrary, to be prepared to maximize our collective effort with the conviction that victory is ours. And when I say victory, it means that we will exercise justice, equality, and peace on equal footing for all of us. Again, Mark, I really want to thank you for a fantastic presentation that you have made, and I appreciate the opportunity that you have given me to speak. Thank you very much.
Thank you very much, Dr. Omar. Patty, can we also provide an opportunity for our student attendees to have the floor? I'm not sure who's in the room there, but perhaps Omar, or Ali, if you're able to unmute yourselves, we'd love to turn the floor over to you for a moment.
So people know there's a room of students tuning into this presentation. So yeah, guys, if you want to unmute there in the room.
Yeah, I just wanted to say and remind everybody, I know Patty already touched on it, but there is a student strike organized by BDS Youth on the Wednesday, October 23rd, I think. So all the unis across Sydney are going to be meeting at UTS, and we'll be able to hopefully really target those ties that Patty was mentioning. So it'd be great to see everybody there. And if anybody wants to sign up to help us leaflet or build for it and get just as many people involved and aware, that would be great. And please come talk to me after. If anybody wants to say something, put their hand up, maybe that are in the room now. Did anybody have anything? Yeah.
I think it's just worthwhile mentioning, like, you know, UTS have obviously let this seminar here happen in this room. And I think, you know, that's obviously for PR purposes. They don't really want a film footage of like students getting into fights with police on their campus when a room's been officially booked. And the way the seminar was disallowed is also obviously problematic. They had to find a little bureaucratic thing. When I was postering for this event on Friday, I was told to leave campus and asked to take the posters down. Like, they absolutely do not want people building around Palestine in this university right now. And I think that just makes it all the more important that we do that because there are things that the community is obviously doing here between these two groups, students and staff for Palestine. And like, so yeah, just underscoring the importance of finding ways to keep up the fight, because the pressure is very real from the university not to do any of this.
Thank you. Is there any other students in the room want to contribute before we move? There's been some other questions in the chat.
No, I think we're all good here. Thank you.
Okay, guys, good on you. Ali, did you have a question?
I do, yeah. Thank you so much, Patty, and thank you again, Mark, for that comprehensive, devastating, very distressing update. And I also want to really acknowledge your work in this area. And I know it's been a really difficult time for you. And it means a lot that you're here today and sharing with us your incredible expertise. Thank you so much. And I also want to thank Dr. Omar Lattouf for being here. And thank you for sharing your email there. So if, I can possibly just follow up with you later, but I sort of have a question about the Gaza Health Initiative. So I worked in Palestine as well, and I co-wrote a report on the Gaza reconstruction mechanism, which I'm sure you're also familiar with. It was established in the wake of the devastating destruction of Gaza back in 2014. It was supposed to be a temporary measure that was supposed to facilitate the entry of construction materials that were deemed by Israel to be, dual use, as in having, a potential military application. And our report found that there was, significant obstruction by Israel, unsurprisingly, under the guise of the blockade, but essentially that a very vital water sector recovery, we focus specifically on the water sector recovery and development was hampered for many years after, because Israel basically was using the Gaza reconstruction mechanism to either severely limit the entry or prevent altogether vital materials from entering. So I'm interested in the GHI. Are there, one thing that we identified was that donors to the mechanism were basically not sufficiently pressuring, what a shock, not sufficiently pressuring Israel to allow the entry of materials. So I'm interested if donors are engaged in those GHI discussions, if they're kind of willing, basically they need to be really willing to push Israel to allow entry of these materials, because, we just kind of found that this mechanism was kind of mirroring the blockade essentially in preventing vital recovery and reconstruction efforts. I guess I'm interested in the GHI, if it's engaging with donors, if donors are there, and if they have an appetite to challenge the blockade and to force Israel to allow the reconstruction and rebuilding efforts. So that might be a question, I don't know, for Mark or Dr. Omar.
So I'd be happy to leave that question to Dr. Omar, actually, if he's still with us. Yeah, Dr. Omar, did you want to say something specifically about the ways in which donors are being engaged by the GHI in order to ensure that sufficient pressure is put on the political parties to the conflict to ensure that the reconstruction can actually take place?
Thank you, Mark, and thank you, Ali. Let me be very transparent with you. GHI is in its formative stage. When we launched it back in February 2023 in Amman, we anticipated that we will have 50 to 100 participants show up. We had over 650 people attend this conference in person and over 300 online. People came without invitation from as far as Australia, Pakistan, South Africa. There were representatives from 44 countries and 250 organizations, including United Nations, UNICEF, WHO, World Bank, and more. Likewise in Lebanon, and likewise at the most recent meeting in Amsterdam. And we have been invited since then for another meeting in Paris and another one to happen in the United States. This happened not because we had a magical formula. It's because the power of the cause is attracting more people to come forward from around the globe to address this issue and to support it. So we gain our power because more organizations are joining us, and more organizations, including the WHO and the World Bank and the United Nations, are paying attention and listening. Yet at the same time, they are expressing their frustration that they are unable to sway Israel and convince them to open its borders to allow the most basic humanitarian needs to be in, or food. We do have some pathways that have worked until recently, The best pathway that we have worked through was the Jordan Hashemite Charity Organization, where the chair of that organization is on the advisory board of GHI. And they have been exceptionally helpful to allow us to send doctors, nurses, and medications through. But most recently, in the last several weeks, that has been extremely limited. So we are facing drastic limitations in our ability to get through. That, be it as it is, does not slow us down from continuing to build momentum. And at this point, our strategic objective is to organize a congress of organizations that jointly commit themselves as people of the world, aiding people of the world. Such a thing does not exist. I know there's an ICRC, there's a WHO, but these are established organizations of established bodies, but there are none that are grassroots like what you and I are doing. And we believe if we can succeed in creating such a global initiative, our collective power will be so strong that our voice will be listened. Thank you.
Thank you, Dr. Omar. Thank you so much.
Thank you. There was one other comment in the chat that I actually missed, and my apologies to Brian for that. It came 15 minutes ago. I'll just read it now. Brian asked that if a ceasefire came to be and the mobilization of critically needed healthcare resources was permitted in Gaza, where will those resources come from? And in particular, is there physical and mental health care provider workforce available regionally who can meet the needs of the population that's been so traumatized by so many years of conflict?
This is a really fantastic question. So I happen to know that Brian has a good deal of expertise in the provision of mental health services, especially to communities that are difficult to access. With respect to the resources that are available, Gaza has, as I mentioned, Gaza has fantastic human resources already in every aspect of healthcare provision. So there are doctors and nurses and allied health professionals and hospital administrators and everyone in between that enable a world-class health system. The fact that Gaza's health indicators are actually as good as they were prior to the genocide is a testament to just how capable and creative and resilient those health workers are. Now, that said, there is obviously a very serious lack of capacity, especially with respect to the physical infrastructure and the technical infrastructure, which has been destroyed. With respect to human resources, there are, for the time being, more than enough doctors that are available to work. What they don't have is access. So you have doctors in diaspora who are not allowed in, and you have doctors there who are not being provided access. And access means security. It means available resources and available facilities. So I think that the human resource component for the time being is actually not the most pressing issue. What's pressing is enabling the doctors who are available to do their work. Now, that said, that's the present. Israel has destroyed Gaza's tertiary education sector, including its only 2 medical schools. And as a result of that, we have a very serious impending crisis with respect to the health workforce pipeline that is being addressed, but without physical infrastructure, university infrastructure, without reconstituted telecommunications, and all the other things that a health student needs to succeed in their training, then we're going to see a very serious health system capacity problem with respect to human resources moving forward. That's been well acknowledged both by the GHI and by others. And so we do have stopgap measures and programs designed to enable continuing education of those health professionals now, either through online, for example, and also through being able to complete their studies in diaspora. So in particular, in the surrounding Arab countries and in Turkey, we have Palestinians who have left Gaza, who will go to those places, complete their degrees, importantly, complete their degrees under and have their diplomas issued by their original universities in Gaza, because a Palestinian university ceases to be if it has no graduates, and then will return to Gaza and continue to provide health services to those people in need. Now, that said, I don't want to paint an overly rosy picture of the challenge that is in front of us, in particular with mental health. And I think it was very clear that even before this genocide, Palestine has struggled to meet the mental health needs of the population. And that there's a lot of reasons for that, both in terms of the mental health in its place, in terms of it is relatively new. And so developing those capacities and integrating them professionally and structurally and socially takes time. You know, it's not an overnight thing that people are able to go see mental health professionals. That's one aspect. Another aspect is that the depth of need is profound. And we're talking about an entire population with needs, an entire population who would be eligible for a referral to a mental health specialist if they were here in Australia, literally. The mental health profession has had to redefine the lexicon of mental health provision for Palestinians, especially in Gaza. We don't use the word post-traumatic stress disorder. It's pervasive traumatic stress. There's no post to it. And in that sense, I think it would be really, I would be remiss to suggest that the necessary human and social and technical resources are already in place and ready to roll with respect to mental health in Gaza. I think that that's one area in particular where there's a lot of work to be done, and that a lot of that work can be supported in the immediate short term through telehealth, which is something that in some cases, you know, mental health is uniquely suited for telehealth support. So those needs are there, but yeah, I think that the biggest question for us is not, you know, how do we send our people there, but rather how do we identify the people there and provide them with the necessary supports that they need to be successful in what they're already trained to do.
Thank you. Were there any other questions for Mark? If people want to either put them in the chat or put their hand up. There was one question about getting the word out in the US, Mark. I just can't find it looking now, but it was just along the general theme of questions that came after your initial presentation about, you know, what to do, the next stages for the movement. But Andrea had asked, how can we bring to light, what do you suggest is the first step for bringing to light the reality of this crisis in the US, which is so universal in its support of Israel?
So that's a great question, and obviously the U.S. role in this genocide is, I mean, this is a U.S. genocide. So that's really a critical question, and it's a strategic question. The United States is gigantic. It is geographically dispersed, and there is a humongous population there. And so even your local representative, your local member of Congress is somebody that you will probably never encounter on a day-to-day basis. And these people are very practiced in pretending to listen. They have great form letters to respond and to diffuse criticism of the status quo, which they overwhelmingly support in the Congress. And I've had a lot of experience lobbying face-to-face with members of Congress and just feeling gaslit to no end. What I would suggest is to return back to my original statement about the importance of starting where you actually are. And one of the most receptive audiences, and one of the audiences, it's not just naturally receptive, but everything about the audience is ready for social change. That's there. It's almost its reason for being is middle schools and high schools. So those young people, as they transition from childhood to adulthood, are seeking alternatives to the status quo as a matter of their own evolution. It is hard baked into them, into their neural nets, to question and to not take for granted and to not take the status quo as given. And so not only are they ready to listen, but by interacting with teachers and their students, you have a lever that allows an exponential growth of the message that you have. So we can get 1,000 people shouting at one congressperson and not moving the needle at all. We can get one person speaking to one classroom, and within the next 10 years, 1,000 people are on side. So I would raise attention to the work of my dear friend and colleague, Jennifer Klein, who we've worked in this area together, but she's a real expert in how to bring these conversations into the classroom, how to get schools on board, how to get administrators on board with the idea that students are able to handle this, how to give teachers the tools they need to be able to handle it well. And of all of the activism that I've undertaken in my life, that's everything from literally laying in the street in front of tanks to lobbying senators to shouting, on the streets of Sydney on Sunday afternoons. By far, the most impactful thing, the generational impact that we've had in classrooms has completely overshadowed everything else. So yeah, I would strongly recommend that you look up Jennifer Klein and Principled Learning. There are tools available to you to start those conversations with your own schools, where your kids go to school, or where they will. You can go in, you can have conversations. There are real tools to enable them to generate a real paradigm shift in the way that and it's a shift that we can already see, by the way. The discourse around this issue has changed dramatically in the 25 years that I've been involved in it. And I believe that we're nearing the tipping point to real sustained change for Palestine and elsewhere.
Thank you. Well, yeah, thanks so much for your incredible presentation, Mark, and for the engagement from everyone who's joined. It's been really really great discussion we've had. We might move to close unless people do have any further questions or contributions. Okay. Well, on that note, yeah, our group UTS Staff for Palestine, we meet on a we meet on a Friday at 12 o'clock. You can join our meetings on Zoom. You can get in touch with Mark. He can get you in touch. But I mean, this is obviously everyone's responsibility, everyone's business, no matter how you're organising to try to take these issues forward and try to take this knowledge that's been shared with us forward and make some change. But I'll just hand over to you, Mark, if there's any final words you'd like to say before we close.
Thanks very much, Patty. I just want to extend my sincerest gratitude to everybody for being here, all the way from Palestine and the United States, here in Australia and elsewhere. It means the world that we come together for these types of things. And I would just end on a note, quote, revisiting something that Dr. Omar Lattouf mentioned earlier, which was that this is not the time for despair, and that there's every reason for optimism. And that feeling that I know a lot of us have, especially when we see the horrors in the news and social media, that feeling that we can become overcome by, that nothing we do can be enough, that hole in our chest, that's not despair, that's love. So that is a privilege to feel that thing. Don't be convinced that that's a sign to stop. It's a sign that you love, and there's no amount of that that's too much. So embrace that and continue to move forward. Palestinians aren't giving up, and so we won't give up either. Thanks everybody very much for being here today.
Thanks all.